Yet we have people in this country, 47 million uninsured or underinsured, who are facing every day with serious decisions about whether they put medicine in their cabinet or food on their table, about whether they see their doctor or whether they can have enough money to even drive to work. And these are serious, serious issues that we have to address in the most industrialized country in the world. So I'm happy we're having this discussion. I hope it's robust and a very necessary time to tackle this, one of our nation's biggest issues.
Okay, you both mentioned the fact that right now $1 in $6 of our gross domestic product is spent on health care. And within the next 30 years, 40 years, it could be, if we do nothing, it would be $1 in $3. Congressman Boccieri, what in the bill before your branch of the legislature, the H.R. 3200 is the one that's furthest along, what in there actually bends that cost curve? What changes things?
There's a couple of things. And one of the things that I think is most important is that we're driving people to see their physician, their primary care physician. Because those uninsured and underinsured folks who don't have access to, whether they have a diabetic condition, whether they have asthma or a heart condition, they need to see their physician. Those are chronic diseases that can be managed well and save money. But when they lose their job and effectively get that pink slip, their health care ends because they can't afford the COBRA premiums that are often as much as their salary. And when they go into the emergency room now because they have a chronic condition that has festered to a point where now it requires immediate attention, they're costing all of us paying in the system 5 times more. So we have to, this bill helps end the notion of using the emergency room as a primary care physician. Number 2, one of the more controversial aspects is it sets up a public option by which there's competition with a menu option of prescribed access benefits and those sorts of things that's going to help drive down the cost potentially. And this is something new. It's a new concept in American debate, and it's something that...
To be clear, we don't know that a public option would drive down the cost. We know that we hope it would. That's kind of what Congress, the operating principle there?
We're using the arguments of competition as an effect of driving down costs.
And I think whose pocket does that come out of then, Congressman Ryan? If costs go down, who's paying?
Well, you're going to save a lot of money to begin with. I mean, let me first just kind of add on to that, and then we can certainly talk about how we pay for this. So you have the prevention. You basically have people getting screenings, catching cancer before they end up in an emergency room and need a mastectomy or whatever the case may be. That saves billions and billions and billions of dollars that we are all paying for now. It's all getting shifted onto your premiums. That's why your premiums and your costs and the small business people are getting strangled because the person going isn't paying. So now under this plan that we're talking about, that person who will be included and have coverage will be paying a copay. So that person who otherwise paid nothing and cost you a lot more will now be paying their fair share and costing you less because they'll be getting this preventative care. Also in Medicare, this is where I think we can save, again, a lot of money. We have people now, especially in communities like ours, Youngstown, Akron, Canton, Cleveland, where you lose your job and you're 55 or 60 years old, but you're not on Medicare yet. So we have, hundreds of thousands, if not millions of people who are in the situation that John just talked about, where they have COBRA or they're paying through the nose for their insurance. They don't get really good coverage. So what they say is, I'm not going to get insurance or I'm not going to get anything done because my insurance is not going to pay for it. I'm going to be in Medicare in 2 years. I'll wait until I get into Medicare. And by that time, these people are sicker. So part of this plan is you are going to have a healthier patient going into the Medicare program. And that is invaluable. You're going to save billions of dollars in that alone.
On the issue of preventive care and providing screenings for cancer is one thing you mentioned, screenings for diabetes, that sort of thing. The Congressional Budget Office says that, in fact, that may cost more than we would save. Because if you're screening 100 people for cancer, for colorectal cancer, and really only 2 of them are at risk, you're wasting a lot of money. What about that?
Well, the Congressional Budget Office hasn't really analyzed the preventative side of things. That's been part of one of the misnomers here is that we're not going to save money.
But I'm just to be clear, I read that in a letter from the director of the Congressional Budget Office. Not to me personally, but
I was going to say
to one of your colleagues.
You know him better than I do. Yeah. He won't even call me. But there may be reasons for that too. But I think, common sense will tell you that these screenings are cheap, and okay, maybe, and I wouldn't cede the point, but what is the value to our society of preventing someone from having cancer? Don't we value that? That is something that I think as a country we need to recognize. And we have gotten to the point in this country where everything is, well, what's the bottom line? And that's how the insurance companies are running things right now. What is the bottom line? And if we have to tell you we can't cover you or we can't give you this procedure, we're not going to pay for it. And I think this can be a more compassionate approach to the delivery of health care.
Congressman Boccieri.
Let me just add something too. Congressman Ryan and I are here today standing up and saying, look, we don't want socialized medicine. We want a system that's uniquely American, one that fits our value, our culture, and our beliefs about a system that's going to help cover everybody. When we think about the 47 million uninsured and underinsured folks, the folks who are underinsured, they move from transition from one job to the next, but yet they had a situation where they were diabetic. And that chronic disease now becomes a pre-existing condition. Mm-hmm. And they can't seek routine visits to their physician or buy the medical supplies that are necessary to help them manage this. And when they're blocked and denied and screened from seeing their primary care physician, that's costing us more money. So ending the idea of using pre-existing conditions as a discriminatory practice, I think in the long term is going to save us money. And Congressman Ryan's right. I mean, we screen people now for colorectal cancer, breast cancer, and we're going to save money in the long term because to manage that disease or that illness in years to come, the costs are going to increase. I mean, this is shown it. An average family in Ohio right now is spending about $12,000 for their medical insurance, which is almost a 90% increase from the year 2000. This is an unsustainable track, and we've got to be able to manage costs.
And one other point too: what's the loss in productivity of someone? I mean, a lot of times we don't even factor that in. We're doing the hardcore black and white healthcare numbers. But this person now misses work for how long? And what's that do to the work situation? I mean, those things all need to be factored in to this discussion.
This legislation does a lot. Insurance mandates for all Americans and then subsidies for the poor who can't afford it, removing pre-existing condition limitations and removing lifetime caps on insurance. Does it go far enough, Congressman Ryan?
Well,
yeah, well, I'm speaking to you.
Yeah. It depends on where it ends up. I think, in my own humble opinion, I think with a public option, I think that would be, in my mind, that would be as far as we can go at this point, and it may be as far as we need to go. And I think it's important that we do this in measured steps as well. No one's talking about Canada. No one's talking about, well, some people are talking about single payer, but that's not a realistic discussion. So this is where we are. And I think this is a very comprehensive bill that will bend the cost curve, will address the pre-existing needs and the subsidies and all that. I think it does go far enough. And that's why you're going to see, I think, with negotiations in the Senate, it's probably going to get pared back a little bit. But I think we want to make sure that we have a bold plan and that we negotiate from that point. And, the key is for us to get something done. When Social Security started, the average age was 60 and you wouldn't get it until years later. It only covered your retirement. It didn't have disability and all of these other bells and whistles, but it was about getting it done and getting something in place. And I think that's my personal goal here is let's get something done that's substantive and can actually bend the cost curve.
Does that feel less ambitious than where you all began with this bill?
Welcome to our world. Yeah, I mean, to me, I'm when I heard about the public option, I was disappointed that people were talking about pulling it off. That's my personal opinion.